Mandated reporter training, elder and dependent abuse. As a hospice professional, you play a critical role in identifying and reporting elder abuse. California law requires mandated reporters complete training on recognizing and reporting elder abuse. This training will cover the definitions of elder abuse, hospice-specific scenarios, recognizing abuse, reporting abuse, and prevention strategies. Elder abuse definitions. Physical abuse is defined as inflicting physical harm or injury, including restraint or seclusion. Emotional abuse is defined as causing psychological harm, including threats, intimidation, or humiliation. Neglect is defined as failing to provide necessary care, including food, water, shelter, or medical attention. Financial exploitation is unauthorized use or theft of an elder's resources. There are many signs of physical abuse. Physical signs you may notice on individuals may include bruises and lacerations on the patient's body, especially in the areas that are prone to injury, such as the arms, legs, and face. Broken bones, especially in patients with osteoporosis or other conditions that make them more susceptible to fractures. Unexplained burns, including cigarette burns, scalding, or electrical burns. Injuries caused by physical restraints, such as bruises, cuts, or skin breakdown. Unexplained head or neck injuries, including subdermal hematomas, concussions, or spinal cord injuries. Unexplained eye injuries, including retinal damage, corneal abrasions, or eye socket fractures. Unexplained lacerations or bruising on the tongue or lips. Patient reporting unexplained pain or discomfort, especially in areas with no obvious medical explanation. Patient exhibits changes in behavior, such as withdrawal, anxiety, or agitation, which may indicate physical abuse. Family members or caregivers provide inconsistent stories or explanations for the patient's injuries. Specific red flags may indicate physical abuse in hospice care, may include unexplained stories about the patient's injuries from family members, patient exhibiting fear or anxiety around a specific family member or caregiver, family members or caregivers unwilling to discuss the patient's care or injuries, patient or family member has a history of abuse, the patient's injuries are consistent with abuse, such as a bruise in the shape of a hand or finger marks. Signs of emotional abuse may include verbal abuse, yelling, name-calling, or using derogatory language, belittling or humiliating, making patients feel worthless, stupid, or incompetent, threats or intimidation, threatening to withhold care, medication, or other essential needs, isolation, restricting patients' contact with loved ones, friends, or community, rejection or neglect, ignoring patients' needs, feelings, or concerns, manipulation, using guilt, self-pity, or gaslighting to control patients, stonewalling, refusing to communicate or respond to patients' needs, emotional blackmail, using emotions to control or manipulate patients, gaslighting, manipulating patients into doubting their own perceptions or sanity, trauma reenactment, reenacting past traumatic events or experiences. Red flags for emotional abuse in hospice care include patient fear or anxiety. Patient exhibits excessive fear or anxiety around a specific caregiver. Changes in behavior. Patient exhibits changes in behavior such as withdrawal, agitation, or depression. Unexplained changes in mood. Patient experiences unexplained changes in mood such as irritability or sadness. Difficulty sleeping. Patient has difficulty sleeping or experiences nightmares. Loss of interest. Patient loses interest in activities or hobbies. Social withdrawal. Patient withdraws from social interactions or relationships. Self-criticism. Patient exhibits excessive self-criticism or self-blame. Unrealistic expectations. Caregiver has unrealistic expectations of patient's abilities or performance. Signs of neglect may include neglecting a patient's basic needs such as food, water, shelter, or hygiene. Failing to manage patient's pain effectively. Neglecting patient's medical needs, including withholding medication or treatments. Neglecting patient's personal hygiene, including bathing, dressing, or grooming. Failing to maintain a clean and safe living environment. Neglecting patient's nutritional or hydration needs. Neglecting to prevent or treat pressure ulcers. Neglecting patient's need for sleep or rest. Neglecting patient's social needs, including isolation or lack of communication. Neglecting patient's emotional needs, including counseling or support. Some red flags for neglect specific to hospice care to look out for when a patient expresses concerns about their care or well-being include when you see visible signs of neglect, such as poor hygiene, malnutrition, or unclean living conditions. When you notice unexplained injuries or wounds. When you notice a change in the patient's condition, such as weight loss or deterioration. When you observe suspect behavior from the caregiver, such as neglecting patient's needs or being unresponsive. The following scenarios are considered financial abuse. Taking a patient's cash, jewelry, or other valuable items. Using a patient's credit cards without permission. Forging a patient's signature on financial documents or checks. Mismanaging a patient's finances, including neglecting bills or payments. Coercing or manipulating a patient to giving away money or assets. Stealing a patient's identity for financial gain. Misusing power of attorney to access a patient's funds or assets. Unexplained disappearance of a patient's asset, such as money, jewelry, or valuables. Patient feels pressure to make financial decisions. Unexplained bank transactions. Specific red flags for financial abuse in hospice care to look out for may include unexplained changes in a patient's financial situation, such as sudden depletion of funds, patient exhibiting fear or anxiety when discussing finances, caregiver's financial difficulties or known history of financial abuse, patient is isolated from friends, family, or financial advisors, or unusual financial transactions such as large withdrawals or bank transfers. As a healthcare professional, it is our responsibility to report immediately, document carefully, collaborate with Adult Protective Services, prioritize patient safety, and provide resources. Report your concerns to your supervisor and local Adult Protective Services. Document the patient's situation, including any suspicious transactions, bruises, behavior, or activities. Work with Adult Protective Services to investigate and address the abuse. Ensure the patient's safety and well-being by providing a supportive and non-judgmental environment. Offer social, spiritual, and financial resources and support to the patient. There are many different scenarios we encounter in hospice care. Let's review a few. Scenario 1. A patient's in-home caregiver is consistently unresponsive to their needs, leading to dehydration and skin breakdown. Respond with empathy and concern. Explore the reasons. Offer assistance. Involve the healthcare team. Document concerns. Seek additional support. Consider involving social services, home health care, or other support agencies. Prioritize patient safety. If the patient is at risk, explore alternative care arrangements, such as temporary placement or increased home health services. Educate and support. Provide the caregiver with resources, education, and emotional support to help them understand and address the patient needs. Remember to approach the situation with empathy and understanding, focusing on patient's well-being and safety. Scenario number 2. A patient reports being verbally abused by a staff member at the care facility they reside in. We recommend empathy and belief. You might say, "I believe you, and I'm so sorry this happened." Giving the patient assurance of safety. You might say, "You're safe now, and I'm here to support you." Confidentiality. You might say, "This conversation will remain confidential, and I'll only share information with those who need to know." Documentation. We strongly suggest that you record the incident in the patient's chart, including details and quotes. Report the incident to the facility's administration, supervisor, or HR department. Ensure a thorough investigation is conducted and the staff member is held accountable. Take steps to protect the patient from further abuse, such as reassigning staff or modifying care plans. Check in with the patient regularly to ensure their well-being and safety. Remember to prioritize the patient's emotional well-being, safety, and trust throughout the process. Scenario number 3. A patient's family member is controlling their finances and limiting their access to their credit card. If a patient's family is limiting their access to their finances, it's essential to respect patient autonomy, support the patient's right to control their finances if they're capable. Assess capacity. Evaluate the patient's ability to manage finances independently. Explore concerns. Discuss the family's reasons for limiting access. Offer resources. Provide information on financial management options. Document. Record the situation, including the patient's wishes and any concerns. Collaborate with the healthcare team. Involve social workers, case managers, or legal advisors for guidance. Support patient rights. Advocate for the patient's rights and interests. Prioritize patient well-being. Ensure the patient's financial situation does not compromise their care or well-being. Remember to maintain a patient-centered approach, respecting their autonomy while ensuring their protection. Scenario number 4. Pain medication is not accounted for. patient's home. Primary caregiver is the only other person who has been at the residence. Involve the healthcare team. Notify the physician and nurse to investigate and address the issue. Educate the family. Provide guidance on proper medication handling, storage, and administration. Monitor the patient. Closely observe the patient for signs of medication overdose or withdrawal. Document the incident. Record the details in the patient's chart, including any discussions with the family. Consider a medication lockbox. Suggest using a lockbox to secure medications and prevent unauthorized access. Follow up. Regularly check in with the patient and family to ensure the issue is resolved. Remember to prioritize the patient's safety and well-being and take steps to prevent future incidents. Mandated reporters are required to report any signs of abuse or neglect. Every single scenario that we reviewed requires a report. Who is considered a mandated reporter? Mandated reporters include healthcare providers, social workers, hospice workers, including employees, contractors, and volunteers, nursing home employees, adult daycare employees, home health care employees, paid caregivers, friends and family members, law enforcement officers, firemen, and social service employees. As a mandated reporter, you have responsibilities. Your responsibilities include recognizing suspected abuse or neglect, identify signs and symptoms of elder or dependent adult abuse or neglect, reporting immediately. Report suspected abuse or neglect to Adult Protective Services or law enforcement immediately, within 24 hours. Verbal report. Make a verbal report to APS or law enforcement, providing as much detail as possible. Written report. Submit a written report to APS within 48 hours of the verbal report. Confidentiality. Maintain confidentiality, but disclose necessary information to investigate and address abuse. Cooperation with investigations. Cooperate with APS and law enforcement investigations. Protection of patient. Ensure the patient's safety and well-being, providing support and resources as needed. Documentation. Document the report, including the date, time, and details of the suspected abuse or neglect. Follow-up. Follow up with APS or law enforcement to ensure the report is being investigated and addressed. If you haven't seen what the California reporting form looks like, we will be reviewing it so you will become familiar. On page 1, you will see the general information that will need to be completed. This page includes information about the victim and the suspected abuser. Page 2 is where you will write your observations, beliefs, and statements by the victim if available. On page 3, you will be reporting incident information such as the date and time of the incident, the place of the incident, the type of abuse, if the abuse resulted in any type of bodily injury or hospitalization, and others who had knowledge of the abuse. On page 4, you will indicate a family member or person responsible for victim's care, who you made the report to, agencies receiving this report, and on section K, you will see the receiving agency will complete the rest. I've included pages 5 and 6 for your review. These pages outline the purpose of the form, completion of the form, reporting instructions, reporting party definitions, and general information. These are the final pages of the report. If you have any questions about filling out a report, please contact your immediate supervisor. Remember, reporting suspected abuse or neglect is your legal and ethical responsibility. Delaying or failing to report can result in serious consequences for the patient and the professional. Your role in reporting helps protect vulnerable adults and ensures their safety and well-being. When in doubt, ask.